One in three people has the risk of developing shingles. That's what the CDC says. But why do you need to know this? If you or a relative is age 50 or more, it's a good idea to get vaccinated, and you must have seen Big B talk about it on the Indian television. Hi, this is Dr. Amrita, and you're listening to the Health Wealth Bridge podcast. But let's start from the very beginning. There are many strange articles and misinformation online about this disease, and today I'll tell you exactly what it is about and how you can prevent it. First of all, it's not a STD or sexually transmitted disease. Second, it's a viral disease and is caused by the same virus that causes chickenpox, but shingles occurs most commonly in the old age. According to the Harrison Internal Medicine book, varicella zoster is a virus which causes two distinct clinical presentations. One is the chickenpox and the second is shingles. Chickenpox is most common in children and has characteristic vesicular rash, while shingles occur as dermatomal rash in specific parts of the body. Chickenpox in adults is a serious disease and may have extensive systemic involvement and complications. Incidentally, vaccination exists even for chickenpox, where, like all other vaccines, one may get infected still, but the expression and clinical disease may limit severity. So, what exactly is shingles? It's caused by the varicella zoster virus, as I mentioned. You remember I mentioned chickenpox, also known as the varicella zoster virus? If that virus gets reactivated in old age, shingles or herpes zoster is what happens. According to the medical science, these chickenpox viruses stay sleeping or dormant in the nerve cells, and during episodes of immune suppression, that is weakness, gets reactivated and starts giving you trouble. They characteristically have a burning sensation associated with skin lesions along the area of distribution of that nerve and makes life difficult. It causes the classical dermatomal rash. The regular painkillers don't seem to work, and prevention often is the best policy. They may suffer multiple episodes with waxing and waning in between, with itching and tingling, burning sensation in specific areas associated with the rashes. The rash can appear on the third to fifth day with or without fever. The herpetic neuralgia or pain is difficult to manage and is one of the main reasons behind poor quality of life. In my ENT clinic, ear manifestation of shingles present as earache with rashes over the pinna and the ear canal. Statistics. In India, 1 million cases of shingles each year. Incidence is about 705 per million population per year. In USA, approximately 1 out of 3 people develop herpes zoster during their lifetime. Over half of people above the age of 80 have had shingles. The shingles vaccine for people above 50 years is a good way to ensure no trouble from the virus. So, when can shingles occur? In people above 50 years of age having any cause of immune suppression because of disease or drugs like HIV, cancer treatment or cancer itself, autoimmune diseases, diabetes, severe cardiac, liver or kidney disease. Any disease which overpowers your immune system can cause shingles. So, the best way to prevent it is to have healthy habits, eat nutritious food, and get vaccinated on time. Shingles vaccine in India is called the Shingrix Zoster vaccine. 2 doses are needed at a gap of 2 to 6 months. Protection is said to be for 10 years. Age group above 50 years. India has 260 million people above 50 years who can be saved from a disease causing poor quality of life with this vaccine. So, who should get vaccinated? At risk group who are greater than 50 years of age, those who have suffered one episode of shingles, or even if they have received the chickenpox vaccine, they can benefit from the shingles vaccine. Consult your doctor for checking whether you are eligible for the vaccine. This is not a replacement for a medical consultation and is strictly for the purpose of awareness. Though we try to keep updates current, since medical science is a rapidly evolving field, inadvertent additions and omissions, while unfortunate, is occasionally unavoidable. Kindly consult a healthcare provider for personalized vaccine recommendations. You were listening to Dr. Amrita on the Health Wealth Bridge podcast.